All right, sir. We're going to ask you a few questions. Tell us about your urine issues.
Well, initially it all started, about a month prior, where I noticed I wasn't doing as well as I did. And as it progressed, about a week before that I ended up in the hospital, I was noticing that I was just peeing much less. And what was going on was, I guess, with my prostate, and I didn't realize that. I thought it might have just been an infection or something like that. But even up to 2 days before I ended up in the hospital, I realized that I was trying to go every 30, 40 minutes, even to the point where I would wake up in the middle of the night and I would go just enough to relieve the pressure off, and then I would try to sleep in 40-minute increments.
What prompted you to go to the hospital?
Well, it was the night before, I remember, and I was talking to my girlfriend, and she said that, it's probably just urinary tract infection. So I, called, your office and made an appointment for the next day. And what happened was, around midnight, I was in so much pain, I thought, okay, I can work through this. Then at 4 in the morning, I had slept for about 30, 40 minutes, and I woke up, and I was in so much pain in my back and my stomach, I could barely walk. And at that point, I got my girlfriend up, and we went to and I was just, trying to dribble anything out I could get. I actually carried a cup in the car just in case of that issue, and I ended up in the hospital. And, they checked my urination and they said I didn't have an infection. We needed to do a CT scan, which was absolutely the most painful thing I think I've been through, to be stretched out on a table. And what happened was, they came back and said, we're gonna put a catheter in you. And I was like, why? And they showed me the scan, and my bladder, which I have a scan of, I don't know how many times larger than it would have been normally, but they told me that they had pulled out 6 pounds of urine out of me. And then I knew at that point, they said, you want to keep the catheter in, or do you want to, for your doctor to see him, or would you like to, take it out? Of course, like everybody else, I said, I don't want this thing in me. So I took it out, and then I called you and talked to your practitioner who you spoke with, and told me that I wasn't going to pee, and I had to be down to your Stockton office and had to have another catheter put back in. And you were correct. I tried, and nothing came out. And, that's how I ended up.
So how did describe the procedure for us when you had the Eurolift done?
It was surprisingly not very painful. When you're coming in and you're thinking you're going to have a procedure done that's going to give you relief, you don't really think about the pain, but still in the back of your mind, you wonder when somebody's putting something up inside you and what it's going to be like. And for me, you had a Valium, you don't have to go under it. And so you just feel a little bit of the effect of the Valium. And then we started, and, we went up, and, I'm not sure exactly what went on. I know there was a bar that was placed up there, and then, you tell me there was going to be a lot of noise, and there was. But surprisingly, there was no pain involved with a lot of noise. And how I kind of deal with pain is laughter. And so I kind of started laughing, maybe a little effects of the Valium, but not much. And I said, come on, doc, hit me again. Let's get it going. And then another lot of noise, and and then a little bit of adjustment, another lot of noise, another lot of noise, and that was it. And surprisingly, that when I said, is that it? And you said, yeah, I just got to get the bar out of there. And I said, really? And you said, yes, that's it. And I was like, wow, that wasn't uncomfortable at all. And especially when you compare it to the discomfort that when I went to the ER, what I actually experienced through this, that was probably a 1 on a 10 scale versus a 10 out of 10 is what I had when I went into the ER.
How fast was the recovery after the procedure?
That was the biggest surprise. You know, when somebody tells you that, oh, you know, you're gonna have like a day recovery, and you think, oh, okay, you know, because you always hear all the stories on the prostate, 6 weeks, 8 weeks that people go through, and you know, of course, I have all the faith in the world in you, but you know, still in the back of our mind, we're kind of like, wow, is that really true? So yeah, I had a little bit of discomfort in the lower region, and maybe a very minor little bit of back discomfort, and went to bed, woke up once with maybe a little discomfort, got up the next morning, thought, okay, am I gonna go to work today? And I thought maybe I'll just work from home and take the day off, and about noon hit, and I basically said, you know, I don't really have any pain at all. I was on no pain medication. You know, I wasn't even taking ibuprofen. And put myself together and went to work for a few hours. So it amazingly, that it, you know, held true what you said.
How has it affected your urination and erectile function since then?
Well, you know, it's funny, I can't remember, you know, urinating this well my entire life. Like, you know, it's funny, you go back, you think when I was a teenager or as a kid, and, you know, you think to yourself, God, how did I pee? Or, you know, when there was a point where we lived in Reno, and, you know, you pee your name in the snow, and you think, wow, you know, I can do that, which is kind of funny, but I know that my bladder empties every single time, full stream. I actually call it the backup test. You know, how far can you go back and still hit the toilet? Which it's not my common thing, but it's interesting enough. Your stream is so strong that I actually literally have to step back from the toilet because my stream is so strong, and you know, that's amazing.
How about sexually?
You know, that was another thing that was concerning. Anytime anybody's going in there, you're always concerned that, you know, what's that going to do to you? And I noticed, you know, even a little bit of better, you know, my sex drive is always there, but you're always worried as you get older that, you know, you're not going to be able to get full function. But I did notice that I did have, you know, definitely a good response to, you know, my erections and how they felt. They just felt a little bit stronger. I don't know if that makes sense, but they just felt better, you know, after this, which was a nice surprise too. Nice added bonus.
Now you come from about 60 miles away, so how did you find us?
Well, you know, when the first time that I found you, I was, you know, getting the vasectomy, and I didn't really find anybody that really impressed me, whether, you know, I didn't see anybody, but you know, you do your research and you do your, you know, you take a look on the internet, but then you take a look up names, and then you talk to somebody about it. And I actually did some research and found, you know, that just, I don't know, just the way it seemed, the information that I found, it seemed like it was a good fit. And it was. I'm very lucky that it was a good fit, just because of the procedure, and, you know, even the vasectomy, you know, was actually not a bad experience. And the Eurolift wasn't a bad experience. And, you know, in the future, I don't have any other issues, but, you know, I think I've definitely found somebody I can trust.